Welcome to our December Lunch and Learn webinar. I'm Liz Nolan, Community Outreach Coordinator for the Northborough Health and Human Services Department. Each month, we are introducing our staff members as they talk about their roles and resources that they can bring to Northborough residents. This webinar is being recorded by Northborough Media Connection. We will also share the link on Facebook and Instagram, which we hope you are following at Northborough HHS. This month, our regional epidemiologist and shared service coordinator, Michaela Petty, is with us, and she will answer a lot of questions we hear from residents, like what is an epidemiologist, are flu cases on the rise, and how can I try to stay healthy this winter, and so much more. So we are going to just hand it over to her so she can get started.
Awesome. Thank you for the introduction. I will share my screen. Okay. Can you see that? Okay. So yes, as Liz mentioned, we'll cover a whole host of things, talk a little bit about what I do, and what you can look out for this season, especially as we get into the holidays and start thinking about what's on the horizon. So I am with the Greater Boroughs Partnership for Health, which is a shared public health collaborative between four towns. Northborough is our host town, which is where I primarily sit and work out of, but we partner with Westborough, Southborough, and Boylston. And really our goal is to share public health services to make sure that all of our residents are served in the best capacity. We offer environmental health services like inspections. We do public health nursing like blood pressure clinics and vaccine clinics, especially this time of year. And then things like today, health education and communication, getting out in the community. And then my role does a lot of data analysis on infectious disease and chronic disease as well. So start with the question of what is an epidemiologist? This is something I get a lot. You don't hear about epidemiologists too often. And the official definition is the branch of medical science that investigates all the factors that determine the presence and absence of disease or disorders. I like to think of it more of studying the who, what, when, and how of various health conditions. And oftentimes that looks at kind of a combination of behaviors and exposures and how that can impact health outcomes and trends in a community. So one thing that we do, especially this time of year, is infectious disease tracking for respiratory illnesses like flu, COVID, and RSV. So we'll talk a little bit about what's going on with that in our community. This is just a broad overview, snapshot, kind of relative levels of flu, COVID, and RSV. As of right now, flu is definitely kind of driving infections and cases that we're seeing in terms of doctor's visits for that kind of respiratory fever, cough symptoms. They are rising pretty quickly, which is what we usually see around this time of year, especially after the Thanksgiving holiday. Things kind of start to ramp up a little bit. COVID and RSV are still pretty low, especially for COVID. There's some increase, but not near as much as what we're seeing with the flu. And then RSV is similar, still very low levels in the community. So we'll talk a little bit more about each of those and what we might see throughout the season. So flu, kind of as a reminder, the symptoms are what you think of when you think of getting sick. It's fever, cough, sore throat. Oftentimes the fatigue and body aches are what kind of distinguish the flu from other illnesses. And in this chart, you can see the past several seasons and kind of year to year things fluctuate in terms of intensity, but general trends, like I said, this time of year we start to see that increase that continues typically until about late January, early February, depending on the year. And then it tapers off throughout the rest of winter and into the spring. Um, So you can see circled here, we're in December, we're still only halfway through. Um, and so this will likely increase in the coming weeks, but we're kind of in this middle zone. Well, the next couple of weeks will determine what that trajectory looks like, whether we kind of go in the similar fashion as last year or we stay on the lower end. Based on some early indications, it seems like we might be on that upper end trend. So we'll talk kind of towards the end about some precautions and ways you can try to stay healthy this season. Um, but yeah, flu is the main character at the moment. For COVID, again, there's a lot of similar symptoms. There's some overlap there of fever, cough, sore throat. Typically not quite as much fatigue or like body aches, and more common to see sneezing and runny nose as a symptom. But as I said, it's pretty low right now. We'll probably see it increase a little bit, but the year, last year was pretty quiet for COVID, so we're kind of seeing a similar trend at this point. So if you are feeling feverish or sore throat, more likely at this stage to probably be the flu than COVID. Now, RSV, it so the previous two slides are specific local data that we have available as a health department. RSV is not reported at the local level, but the state definitely keeps track of it to see where we're at throughout the year. Um, and that is still relatively low. RSV typically impacts young kids, and older adults. So the symptoms are still very respiratory in nature, but for infants, it can also mean decreased appetite, wheezing, or things like that. So, still something to look out for, especially if you are a parent of young children or if you yourself are an older adult. Now, one of the things we can always talk about with respiratory season is vaccines. They're a great way to provide some protection against infection, but also from severe illness. So flu and COVID vaccine rates for this year are a little bit lower than where we would like to see them. Last year we had a 50% vaccination rate in our region. Right now it's sitting at about 37%, which, there's still some people getting last minute vaccines, so hopefully that increases over time. But typically we try to shoot for about 40 to 50% of the population being vaccinated, to help us provide a little more herd immunity as we move throughout the season. COVID vaccine rates are also down compared to what we've seen last year, a little bit more significantly than what we see with the flu. Last year we had a 30% vaccination rate, and right now we just have 13%. Again, I'm sure there are people still coordinating and figuring out when and where they want to get vaccinated. But this is definitely one of our best strategies to reducing overall infections and severity of illness. Another vaccine that to me is really exciting in recent years is the RSV vaccine. It's proven to be very effective in reducing severity of illness and the number of cases we're seeing. And this is huge, especially I'm sure for people that take care of pediatric populations, because it can be really just a nasty virus for those young kiddos. So we do actually have a pretty good vaccination rate. 51% of infants are protected due to vaccination, and this can either be through maternal vaccination during the third trimester, or there's monoclonal antibodies that can be given to infants after birth. And then 39% of adults over 75 are vaccinated for RSV, which is pretty good, especially considering it's a newer vaccine, but definitely is recommended for both those groups to protect against severe illness. So we've talked about vaccination, which is one way to for sure stay healthy and kind of protect yourself and your family throughout the season. But there are a couple other strategies as we get into some more robust activity throughout the season. So there's kind of three tiers of protection. There's things that you should do kind of regardless of the time of year, regardless of how much activity there is out there. there's another tier of what you should do when there's increased activity. And then the final tier is like, if you are sick, how to protect other people from getting sick as well as take care of yourself. Um, so the first tier is those core prevention strategies. We already talked about getting vaccinated as a really good strategy. Hand washing, it's always a good reminder to think about practicing good hand hygiene and cleaning surfaces to help reduce not only flu and COVID, but a whole host of other illnesses. And it really is a great tool that we have. As well as I know this is a harder one during the winter, but getting fresh air as much as possible, even if it's just stepping outside for a little bit or cracking a window when it's not super, super cold, or even using indoor purifiers can help kind of circulate the air and keep pathogens at bay as best as you can. So then I mentioned this additional prevention strategies. So these are things that you want to do, especially this time of year, kind of as we're seeing those cases start to rise. This is something you can add in to help add a layer of protection. One of which is wearing a mask when either you feel sick or if you're going to be in a crowded space with a lot of other people. Definitely a good strategy to kind of protect the people around you, but then also protect yourself when you're in crowded spaces. Again, physical distancing, just providing some space. Pathogens can't always travel that far, thankfully. So just that a little extra distance can help protect yourself and again, protect others. And then third is testing. If you feel sick or are about to go somewhere, you can find a rapid test and do that, or talk to your primary care if you want to go into the office, especially if you are feeling sick. But this can be a helpful tool in kind of gauging your own risk and what steps you might want to take after that. Finally, I hope nobody gets sick, but unfortunately this time of year it's pretty hard not to. So when you do get sick, there are some important strategies that you can use to not only help your body kind of recover and get back to being healthy, but also protecting the people around you. So the recommendations, kind of regardless of what the illness might be in terms of respiratory, so whether it's flu, COVID, um, is to stay home until your symptoms improve and the fever is gone for at least 24 hours. Um, I understand life happens, but this is the best way to do it. And then if you can't do that, or even if you can, some extra precautions when you're out and about while you're still feeling under the weather, like masking or that physical distancing that we talked about in those other strategies. And then, really, anytime you're sick, monitoring symptoms, watching for anything that might be worsening or new symptoms that appear. Want to make sure that you're taking care of yourself and talk to your doctor if anything kind of continues to get worse and doesn't improve over time. So that was kind of rapid fire what's on the horizon for the season and hopefully some reminders and strategies to stay healthy. Um, a fourth layer that's not officially recommendations for staying healthy necessarily, but there are some good ways to stay up to date on what's going on, not only with infectious diseases, but also with our group in the 4 towns. So we have a website, which every 2 weeks I do post a bi-weekly epi update, which contains pretty much all the information that we just went over about what we're seeing, ways to stay healthy. So that goes up every 2 weeks. And we also have an Instagram where we post about health alerts and programs and events that we're doing. And then lastly, you can always contact your local health department if you have questions or need to find resources. And with that, I will open it up to if there's questions or anything else, Liz, that you want to touch on before moving on.
No, I think that gives everybody a good overview of what is out there and what's available. And like you mentioned, you have your every other week updates, which can be followed. We also include some of Michaela's updates on our monthly newsletter, which you can sign up for on the town web page. And also it's posted on our link for our department. I don't have any other questions. Does anybody else have any? Okay, so this will be posted on Northborough Media Connections YouTube page as well, and we'll try to get that link so that we can also post it on our social media so people who haven't been able to watch it live can catch up, because there's such good information in that. And our next one will be on January 20th. So just keep that in mind, and we want to just wish everybody a happy holiday season and a great start and healthy start.